As a result of the accompaniment program with Prevention Collaborative, there are things we are doing differently, definitely. One of it, other than our programming bits, where we are now using a gender transformative lens in terms of implementing our programs, in terms of institutionalizing our best approaches, we have also changed as individuals. I know this has been, it was an initial tough discussion at the beginning because we were also challenging our own gender biases, our own thinking around these things. So beyond our programming, at personal level, I've seen a lot of transformation in our teams in terms of looking at things differently, even in their personal lives. And this has been very instrumental because based from that lens, then the team is able now to think differently in programming because we are part of this environment. The biases that have been there before, we were also affected by it, and some moments perhaps we were also propagating the same. So those initial discussions that we had with mentors from Prevention Collaborative enabled us look internally within ourselves, challenge those stereotypes that we had within ourselves. It was a difficult, sometimes frustrating moment, but at the end of the day, then we saw it as something that we need to think through, challenge ourselves, challenge the status quo, so that we can be able to transform ourselves and thereafter be able to transform the communities that we serve. It has also enabled us to do things differently in the sense of how do we look at violence prevention, because it's a whole continuum.
I have learned many things, but one that actually for me shocked me is that sensitization is not prevention, because that's what we have done for many years. Go call people together, tell them about gender-based violence and leave them and expect them to change. So for me, that is what I took away and has driven me up to now.
The participation in the cluster program has had impact in our work in terms of learning what other institutions are doing, getting more reflection, introspectively about the work that we do around prevention of gender-based violence. And this has helped us really have clarity in terms of the linkages between the prevention work and the response work that we continuously do. And
things I've learned from the prevention team is that there is no one way that fits all. It's important to prevent, but you need to be very deliberate in the context when you're operating, so that whatever prevention mechanism we adopt, we are very clear and being very intentional to demonstrate that this is prevention and this is response and this is something else. So for me, that has been a learning curve, whereby any program that we do in our office, we are very direct on what it is, so that we don't claim prevention when it is not, neither do we claim that it is a response when it is not. And therefore we're clear on what is primary or what is secondary in the schemes of work that you're doing.
The cluster program provided a lot of practical lessons that are actually, I would say, almost on real time and what is factual on the ground. We've been able to see improvements in the way we've integrated the learnings into our day-to-day implementation of our project activities. We know how to collaborate better. We know how to involve women and girls, and I would say it has really transformed in the way we do our day-to-day business as GVRC.
Since our participation in the cluster program, what we did is we were working on reviewing our materials, the work, especially because we got to learn that it's important for us to know what is prevention, what is response, and what is what is happening in between. So we were able to separate and review our proposals. We were also working on a new proposal with a funding partner, and we incorporated a lot of the learning from our cluster program, and we are implementing that particular program.
The cluster program helped us identify what prevention is, what are the essentials of prevention. If you want to do a prevention program, what are the things that need to be in place, the foundation? How do you do it? How do you do the monitoring and evaluation? How do you do the dissemination? Who are the people who you need to collaborate with? And that just doesn't benefit me as an individual and my career, but also giving identity to the organization, saying that there's somebody there who's very passionate about VAC prevention. That is what the cluster program did for me. So right now, moving forward and since then, I can very comfortably say who our strategic partners are in VAC rather than before where it used to be everybody who's doing something related to GBV. I can very purposefully say who are the stakeholders that I need to engage with or collaborate with to move the VAC prevention and the VAO prevention agenda forward. So it's helped me to streamline my thoughts, streamline my actions within the organization, purpose myself towards VAC prevention in a manner that I feel nobody else has out there. So it's giving me purpose at the policy tables, it's giving me purpose when I'm talking to our donors on what it is that we do and how we intend to do prevention at Alberta City Health.